Everything about growth hormone therapy. Introduction. Have you ever heard about growth hormone therapy? You might be wondering whether it's really necessary for your child, what benefits it offers, and if there are any side effects. Growth hormone therapy isn't just about increasing height, it plays a key role in overall physical development and health management. However, there's a lot of misinformation and misunderstandings surrounding this treatment, leading many parents to feel confused and sometimes miss the optimal time for intervention. That's why I'm here to break down everything you need to know about growth hormone therapy from A to Z, in a detailed and easy to understand manner. There's so much information that it might be difficult to go through it all at once, so I've divided it into 2 parts for better comprehension. In the first part, chapters 1 to 5, I'll cover the basic concepts and functions of growth hormones, the benefits and potential side effects of therapy, the pros and cons of various products, and the lifestyle habits that need to be managed along with growth hormone treatment. In the second part, chapters 6 to 10, I'll delve into its correlation with early puberty, factors to consider during treatment, the frequency of clinic visits, and how to manage daily life after completing the therapy. I'll also discuss how growth hormone therapy can impact a child's psychological and social development. If you're curious about any of these topics, be sure to read through to the end. Growth hormone therapy is not just about increasing height. It's a valuable treatment that can enhance your child's overall health and boost their confidence. Are you ready to learn more about your child's growth in detail? Chapter 1, Overview of growth hormone injections and the importance of growth plates. Definition and role of growth hormones. Growth hormone, GH, is a crucial protein hormone produced by the pituitary gland. Simply put, it's a hormone that helps our bodies grow and develop male sign. It primarily stimulates bones and muscles to promote height growth, while also regulating metabolic functions throughout the body. Female sign. When growth hormone is converted into insulin-like growth factor 1 IGF-1 in the liver, it controls various growth and metabolic processes throughout the body. Not only does it help increase height, but it also breaks down fats and synthesizes proteins, making bones and muscles stronger. So, it's an essential factor for children and adolescents during their growth period. By managing this important growth hormone at the right time, it can significantly contribute not only to height growth but also to overall physical development. The relationship between growth plates and growth hormone therapy. Growth plates are cartilage tissues located at the ends of bones, where the bones grow, leading to an increase in height. When growth hormone acts on these growth plates, the cartilage cells actively proliferate and transform into bone, resulting in height growth. That's why growth hormone therapy is most effective when the growth plates are still open. As long as the growth plates haven't closed yet, growth hormone therapy can greatly aid not only in height growth but also in overall growth and development. But what happens if the growth plates have already closed? In that case, it becomes difficult to expect further height growth. However, growth hormone can still help increase bone density, reduce body fat, and increase muscle mass. In other words, after the growth plates close, the focus of growth hormone therapy shifts to optimizing metabolic functions. Effects of growth hormone therapy after growth plates have closed. Isn't growth hormone no longer necessary once the growth plates have closed? You might think that, but that's not the whole story. After the growth plates close, growth hormone therapy shifts its focus from height growth to improving metabolic functions, such as reducing body fat, increasing muscle mass, and enhancing bone density. For example, in adults, growth hormone therapy can help with anti-aging, boosting energy levels, and treating conditions like metabolic syndrome. So, if it's determined that growth hormone therapy is still needed after the growth plates have closed, you can consider it for metabolic improvement purposes in consultation with your doctor. Therefore, don't think it's all over once the growth plates have closed. Necessity and types of tests. Before starting growth hormone therapy, there are several essential tests that need to be conducted. These tests help accurately determine your child's growth status and whether there is a deficiency in growth hormone. The commonly performed tests are as follows. KCAP1 Growth Hormone Stimulation Test. A medication that stimulates the secretion of growth hormone is administered, and blood levels of growth hormone are measured at regular intervals. If the results fall below the reference range, it can be diagnosed as growth hormone deficiency. KCAP2 Bone Age Test X-ray. An X-ray of the wrist is taken to determine the bone age, which is then compared to the child's actual age. If the bone age is delayed or advanced, it could indicate growth hormone deficiency or early puberty. KCAP3 blood test. In addition to checking growth hormone levels, other hormones such as IGF-1, thyroid hormones, and insulin levels are also evaluated to assess the necessity and safety of growth hormone therapy. Accurately understanding your child's condition through these various tests is crucial for establishing an effective treatment plan. Alarm clock. Optimal timing to start treatment. The best time to start growth hormone therapy is when the growth plates are actively open. Ages 4 to 6 are considered the optimal period. Starting treatment during this time not only promotes height growth but also has positive effects on overall physical development. If your child is diagnosed with growth hormone deficiency, it's important to begin treatment as soon as possible. The earlier the treatment starts, the more your child's growth potential can be maximized. Conversely, if the treatment is delayed, its effectiveness may decrease. Additionally, children with conditions such as Turner syndrome, Prader-Willi syndrome, or small for gestational age, SGA, should also begin therapy early. Taking into account the characteristics of each condition and the child's individual state, it's vital not to miss the optimal treatment window. Starting growth hormone therapy before puberty during early elementary school years can help maximize height growth before the growth plates close. Since the growth plates rapidly close once puberty begins, it's best to start treatment beforehand, right? That's why starting therapy before puberty is considered ideal. Growth hormone therapy should be initiated based on accurate diagnosis and testing, and it's most effective when the growth plates are wide open. If you're worried that your child is shorter than their peers, it's a good idea to first check for other factors that might be hindering growth and then consider growth hormone therapy. Consistent management with growth hormone injections while the growth plates are still open is crucial for achieving the best growth outcomes. Chapter 2: The effects and side effects of growth hormone injection therapy. Effects of growth hormone therapy. Receiving growth hormone therapy doesn't automatically guarantee rapid height growth. However, for children with growth hormone deficiency, the results can be quite significant. On average, many children grow an additional 5 to 10 centimeters, and some even reach a final height of 160 centimeters or 170 centimeters or more after treatment. However, the outcome can vary depending on factors such as the timing of treatment, genetic factors, and the child's overall health condition. For example, even if the parents are short, growth hormone therapy can sometimes help overcome genetic limitations and achieve a taller height. Additionally, for genetic conditions like Turner syndrome or Prader-Willi syndrome, growth hormone therapy can provide not only height growth but also benefits such as reduced body fat and increased muscle mass. In the first year of treatment, children often experience a rapid growth spurt, with many growing 8 to 12 centimeters. If treatment is continued consistently for 2 or 3 years, the growth effects can be sustained, significantly impacting the child's final height. However, remember that the effectiveness of therapy greatly depends on when treatment begins. Play button. Key effects and expectations of treatment. Growth hormone deficiency. After treatment, girls can reach a height of over 160 centimeters and boys over 170 centimeters. Idiopathic short stature. An additional growth of 2 to 3 centimeters per year can be expected during the first year of treatment. Turner syndrome. Treatment can result in an additional 5 to 8 centimeters of growth and has positive effects on muscle development and body fat reduction. Prader-Willi syndrome. It helps not only with height growth but also with weight management. Growth hormone therapy can significantly contribute to a child's overall physical development. It's not just about increasing height. It can also lead to stronger muscles, reduced body fat, and improved bone density, providing multiple health benefits. Side effects and management of growth hormone injections. Of course, there may be concerns about side effects. Although growth hormone therapy has been proven to be safe through extensive clinical data, some side effects can still occur, but don't worry too much. Most side effects are temporary and can be effectively prevented or alleviated with proper monitoring. and management. Common side effects: joint pain. During the initial stages of treatment, your child might say, "My knees hurt" or "My legs feel numb." This is a temporary condition that occurs as the growth rate increases. Adjusting the treatment dosage to match the child's growth pace usually resolves the issue. Don't be too alarmed. Applying cold or warm compresses can help relieve the pain. Snowflake. Increased insulin resistance. Growth hormone can affect insulin, which may cause an increase in blood sugar levels. If there is a family history of diabetes, it's essential to monitor blood sugar levels closely before and after starting treatment. Headaches and blood sugar fluctuations. Headaches or blood sugar fluctuations may occur during the early stages of treatment. However, these symptoms typically resolve on their own within 1 to 2 weeks, so there's no need for major concern. Injection site pain and local reactions. Pain or redness may appear at the injection site, but this is also a temporary reaction that should gradually improve. Thyroid function suppression. Growth hormone therapy can slightly lower thyroid function, so regular thyroid function tests are recommended. If needed, supplementation can be provided. Warning: rare side effects. Sleep apnea. In overweight children or those with large tonsils, sleep apnea may worsen during growth hormone therapy. It's important to carefully monitor the child's weight and sleep condition before starting treatment. Increase in mole size. Since growth hormone stimulates cell growth, it may rarely cause an increase in the size of moles. However, this is a very uncommon occurrence, so there's no need for excessive concern. Carpal tunnel syndrome. Raised hand. Fluid retention can cause swelling and tingling in the wrists. Most of these symptoms resolve with dose adjustments or discontinuation of therapy. Gynecomastia in boys. Rarely, overweight boys nearing puberty may develop gynecomastia, enlarged breast tissue. However, in most cases, these symptoms disappear with regular exercise and weight management. Male sign. Safety and monitoring methods. To safely proceed with growth hormone therapy, regular testing and monitoring are essential. During the course of treatment, the following tests should be conducted regularly to carefully track your child's condition. Blood tests. Monitor changes in growth hormone levels, IGF-1 levels, thyroid hormones, and blood sugar to ensure there are no abnormal reactions. Bone age test. Use wrist X-rays to track changes in bone age and regularly check whether the growth plates are still open. Thyroid function test. Regularly check for any decrease in thyroid function. If abnormalities are detected, supplementation can be provided to manage the condition. Evaluation of growth rate and physical changes. Assess changes in height and weight, as well as overall health status, to ensure that metabolic functions are steadily improving. Female sign. By monitoring consistently, any adverse reactions can be addressed immediately, ensuring that the treatment progresses safely. Long-term effects and safety review. Growth hormone therapy not only helps with high growth but also improves metabolic functions and supports overall health. Even after the growth plates close, children who have received treatment should continue to be monitored regularly, as the benefits of improved metabolism and reduced body fat can persist in the long term. This means that growth hormone therapy can contribute to physical development even after growth has ceased. Regular monitoring, managing side effects, and maintaining open communication with your doctor are key to the successful administration of growth hormone therapy. In the next chapter, I'll cover the various types of growth hormones and how to choose the right product. This is a crucial aspect for parents considering growth hormone therapy, so be sure to pay close attention until the end. Chapter 3: Types of growth hormone injections and choosing the right product. With so many different types and brands of growth hormone injections, it's easy to get confused, right? Don't worry. In this chapter, I'll explain the pros and cons of each product and how to choose the right one in a simple and straightforward way. Domestic versus imported growth hormone injections. Which is better? Growth hormone injections are generally divided into domestic and imported products. Both have their own advantages and disadvantages, so it's important to choose based on your specific situation. Heavy check mark. Advantages of domestic products specifically designed for Korean children's physique. Domestic products are often tailored to suit the physique of Korean children. As a result, they tend to cause less pain and have a lower incidence of side effects. Affordable cost. Domestic products are relatively affordable, which reduces the monthly financial burden. For example, for a child weighing 25 kilograms, the monthly cost is around 500,000 KRW. It's also easier to get insurance coverage, further lessening the economic burden. Extensive clinical data. There is ample clinical data available for domestic products in Korea, making them familiar and reliable choices for many doctors. Heavy check mark. Advantages of imported products. Clinical reliability. Imported products are developed in pharmaceutical powerhouses like the United States, Germany, and Switzerland. They are created based on extensive research and experience, which ensures high clinical reliability. Various formulation options. Imported products come in various forms, such as vial types, pen types, and long-acting formulations. This allows for selecting the most suitable product based on the child's age, weight, and growth rate. For example, instead of daily injections, there are long-acting injections that only need to be administered once a week, making it a good option for children who find daily shots challenging. Advanced technology from global pharmaceutical companies. Products from renowned global companies like Novo Nordisk and Pfizer have abundant clinical data and extensive usage history. They also offer advanced formulations and specialized products, providing a wider range of choices. Different forms of growth hormone injections. Growth hormone injections can be broadly categorized into vial types, pen types, and long-acting injections. Each type has its own characteristics, so it's important to choose the one that best suits your child. Keycap 1 vial type, liquid in a glass bottle. Characteristics. The growth hormone is contained in a glass bottle vial and needs to be drawn into a syringe for each use. Advantages. Allows for precise dosage adjustments, making it suitable when small and accurate dose modifications are needed. Disadvantages. Preparing the injection can take time, and if you're not used to using a syringe, it can be inconvenient. Recommended for situations where precise dosage control is needed or when gradually increasing the initial dosage. Keycap 2 pen type, convenient, pen-like form, pencil. Characteristics. This form resembles a pen with a cartridge, making it easy to use and convenient to carry. Advantages. Many pen-type products are designed for self-administration, making them a great choice for parents who want their child to practice self-injections. Disadvantages. Some pen-type products only offer fixed dosages, so adjusting the dosage can be inconvenient when needed. Recommended for training your child to self-inject, or for cases where frequent injections are needed and convenience is a priority. Keycap 3 long-acting growth hormone injection, extended release, hourglass. Not done. Characteristics. The effects last for 1 to 2 weeks after injection, so there's no need for daily injections. For example, a once-a-week injection can significantly reduce the burden of daily shots. Advantages. Reduces the frequency of injections, minimizing discomfort for the child and alleviating the stress of managing injections for parents. Disadvantages. The initial cost is higher and the absorption rate can vary, leading to different effects depending on the individual. Recommended for children who have a fear of injections or for busy families who don't have time for daily injections. Female sign. Things to consider when choosing growth hormone injections. When selecting a product, it's important to consider which type of injection your child feels most comfortable with. If daily injections are too challenging, you might want to switch to a long-acting injection. Also, the cost of growth hormone injections varies depending on the child's weight, so it's essential to factor in the economic aspect, child's weight and health condition. For children with lower body weight, choosing a low-dose product E12 units can be more economical, while children with higher body weight may benefit from a higher dose product E36 units. Alarm clock. Frequency of injections and ease of use. If daily injections are too overwhelming, consider long-acting formulations or pen-type products, which can help reduce the reluctance towards injections. Insurance coverage. If your child is diagnosed with specific conditions, e.g., growth hormone deficiency, Turner syndrome, you may be eligible for insurance coverage, which can greatly reduce the financial burden. Be sure to check insurance eligibility before starting treatment. Self-injections and long-acting growth hormone injections. Since growth hormone therapy is a long-term treatment, you might want to consider options that allow your child to self-administer injections. These days, many pen-type products are designed to help children get accustomed to self-injections. Pencil. If your child learns to self-inject, it can also relieve parents from the burden of administering injections. Additionally, long-acting growth hormone injections only need to be administered once a week or once every 2 weeks, greatly reducing the frequency of injections. This can be a great choice for children who have a fear of needles. Male sign. Conclusion: choosing the right growth hormone injection for your child is key. In conclusion, there are various types and methods of using growth hormone injections. It's crucial to consult thoroughly with a specialist and carefully assess your child's situation to choose the product that best suits them. Remember, growth hormone therapy is not just about increasing height. It's an essential treatment that can enhance your child's overall health and boost their confidence.